Patrick Brown, Mayor of the City of Brampton, and welcome to our weekly COVID-19 update. Today I'm joined by City Councillor Harkirat Singh, who will give a bylaw update. I'm also joined by Dr. Lawrence Lowe, who is our Medical Officer of Health in Peel Region, and Dr. Naveed Mohammed, who is the President and CEO of the William Osler Health Network. I want to start off by highlighting the fact that I know many of you are disappointed that outdoor amenities have not been opened up. I know I'm a broken record on this. I continue to believe that outdoor amenities are good for physical health and mental health, and we will continue in a determined fashion to raise this concern to the province in hopes that it will be lifted before the provincial lockdown ends on June 2nd. It's going to be tough enough with this great weather and the ongoing closure provisions. What has been medically advised to be safe should certainly be permitted. Golf, tennis, cricket, baseball, sports that don't involve a lot of close proximity are safe, and I hope this will get looked at. In terms of vaccines, we've had a lot of recent success on vaccines in Peel Region. I want to thank Dr. Lowe for the efforts with Doses After Dark, which was a 32-hour marathon clinic, and it is going to help us get to our goal of 75% first dose coverage among all eligible residents. They were able to administer over 5,000 vaccines at that marathon clinic, and what I loved about it is there are a lot of essential workers in Peel Region who can't necessarily go to a standard appointment time, and having a clinic that's open at all hours gives an opportunity for those who work shift work to go very early or very late. And the fact that it was so busy speaks to the fact that it's a great format for getting needles and arms, and I do hope that one was in Mississauga, focusing on all of Peel Region, and I'm hopeful that we're going to have a Brampton version of that very soon. We've got some more good news. Effective yesterday, on May 18th, Peel clinics began administering Pfizer to those 16 plus who live or work in Peel. Registration for youth age 16 and 17 is available online using Peel Region's booking system. And building upon that focus to get our youth vaccinated, I'm very happy to announce today that beginning Thursday, May 20th, individuals aged 12 to 15 who live, work, or attend school in Peel will be eligible to book appointments in Peel Region. Once again, those over 12 plus will be eligible for vaccines starting Thursday, May 20th. Bookings will be accepted for those over the age of 12 starting tomorrow, which is great news. Pfizer is currently the only vaccine authorized by Health Canada for use in this age group. Appointments for individuals 12 to 15 must be booked online using the Region of Peel's booking system. Any 12 to 15-year-olds should be accompanied to their appointment by a parent or guardian who can provide verbal consent. If you need help booking, call the Region of Peel COVID-19 vaccination line at 905-791-5202. As per ministry guidance, appointments will be available at all 7 Peel Public Health mass vaccination clinics, as well as the mobile school clinics. Given the interest and demand to book appointments at our clinics, residents are encouraged to book as soon as possible. Generally, the fastest way to book an appointment is online, and so this new vaccine coverage for our new age cohort in Peel Region is welcome news. And I want to thank Peel Public Health for adapting so quickly. The more people we get vaccinated, the sooner we're going to get back to normal. I also wanted to bring up today a reminder about the long weekend. We are so close to the finish line. This is, if you're running a marathon, this is kilometer 41, and I just want to remind everyone there are lots of safe activities you can do this long weekend. You can go enjoy our cycling paths, running trails, walking trails, but please, no large gatherings. We can't afford any instances that would cause a spike in cases when we're really starting to see a very impressive decline of cases. And so we're almost there. Vaccines are coming in large numbers. We're starting to make real progress. And frankly, if you look at the provincial numbers, the decline in Peel and Toronto is helping drive the provincial decline. And so this rollout of vaccines in hotspots is working. Just hold tight for a little bit longer, and very soon, I believe we're looking at better days where things are open again. On that note, it's my pleasure to introduce a special guest that we have at today's COVID briefing, and that's Dr. Naveed Mohammed. Dr. Mohammed has been doing an exceptional job at Osler Health. As we know, Brampton Civic in particular has been one of the busiest hospitals on the front lines of COVID-19. And not only is he running the administration on a regular basis, he steps into the front lines and acts as a physician as well. So I think we're very fortunate in Peel Region to have a leader as dedicated, devoted as Dr. Mohammed. So on that note, Dr. Naveed Mohammed.
Thank you, Mayor Brown, and good morning, everybody. I truly appreciate this opportunity to join our mayor to update the city of Brampton on Osler's ongoing COVID-19 response. For more than a year, our incredible staff, physicians, and volunteers have persevered to continue delivering safe, quality care through what has been the most challenging period in Osler's history. I'm incredibly proud of this unrelenting commitment to our patients and our communities, and the many personal sacrifices our staff have made to ensure every patient who comes through our doors has access to the care they need. At the peak of Wave 3 in April, Osler had more COVID-19 patients through its doors than any other hospital in Ontario. Osler continues to provide care for a high number of COVID-19 patients as we speak. Currently, we have 78 COVID patients at our hospitals, including 48 at Brampton Civic Hospital. We're providing care to 9 patients in our ICUs, including 6 at Brampton Civic. Thankfully, this is a journey we have never taken alone. We're so grateful to the unwavering support we have received from Mayor Brown, from City Council in Brampton, the City of Brampton, and from my colleague Lawrence Lowe and Peel Public Health, as well our communities who have continued to support us on so many levels. We are truly all in this together. We're also indebted to our hospital partners across Ontario who have graciously accepted the transfer of Osler patients to their facilities over the past few months so that we could continue to meet the growing needs of our communities here locally. If there have been any shining moments through this pandemic, one of them would be the unprecedented level of collaboration amongst Ontario hospitals during this time. It's been truly inspiring. Over the course of the pandemic, we have transferred 1,125 patients to other hospitals. This is the most of any organization in the province. Without this process, we would be lost here in this region. Earlier this month, our teams received an added lift when we welcomed the arrival of 9 highly skilled nurses and physicians from Newfoundland and Labrador to work alongside Osler's teams to provide care for our patients with COVID-19. We have also received support from the Red Cross, with 7 nurses arriving this week to provide additional capacity. As we continue to treat a high number of COVID patients with COVID-19, we're also helping to end the pandemic by minimizing the spread of the virus in our communities. Last week, Osler opened a new vaccine clinic at Century Gardens Recreation Centre at 340 Vaudin Street East in Brampton. This site was made possible thanks to the City of Brampton and Brampton Fire and Emergency Services, who are helping to staff this new clinic. Appointments are available, and I strongly encourage anyone aged 16 or older to book an appointment on our website or call Osler's booking line. We will also work with our colleagues at Peel Public Health to launch the 12 to 15 process once we are ready. Since opening, our clinics in Brampton and Etobicoke have administered over 158,000 doses of the COVID-19 vaccine. I'm very proud of these efforts, and Osler is continuing to do everything we can to support public health and the Ministry of Health with the vaccine rollout. Once again, we are grateful to the community for everything being done to help stop the spread of COVID-19, including vaccinations and adherence to public health measures. Working together, we will see healthier days ahead in Brampton. Thank you so much.
Thank you, Dr. Mohammed. Next up, we'll hear from City Councillor Harkirat Singh on a bylaw update. And I want to thank our bylaw officers who continue to be on the front lines of trying to make sure that the public health advice is adhered to, the provincial regulations are enforced, and often it puts them on the front lines of difficult situations, but they've been integral to our COVID response.
Thank you, Mayor Brown, and thank you for your continued advocacy. Good morning. We know that our community is working hard to help reduce the spread of COVID-19 virus. Our enforcement officers and other first responders are focused on keeping everyone safe. Despite many challenges, they are dedicated in providing the best service to our community. Between May 10th and May 16th, officers laid 33 charges. 2 charges were under the mandatory face covering bylaw, 22 charges under the Reopening Ontario Act, and 9 charges under the Emergency Management and Civil Protection Act. While the majority of residents have been cooperative, we continue to see large social gatherings take place in homes and sometimes in retail locations such as warehouses. So far in 2021, Brampton responded to 2,200 complaints about illegal private gatherings, and in some of these instances, our officers face verbal and physical threats and assaults. I also want to acknowledge we again had a bylaw officer this past week assaulted. Brampton City Council is united against this type of actions being taken by residents, and we stand by our bylaw officers. Charges have been laid, and we thank Peel Police for all their help as well. Such acts endanger the efforts of the community that is working hard to recover from this pandemic. To stop the spread of COVID-19 and ensure public and officer safety, the City of Brampton, along with the City of Mississauga, have strengthened our partnership with Peel Regional Police. Peel Regional Police will provide these cities with dedicated resources for a more coordinated response to large, organized gatherings that present a direct threat to public health. This collaborative initiative is focused on responding to complaints for large gatherings. This is not about spot checks, such as stopping of vehicles. In hotspots where officers have seen social gatherings take place, such as in retail plazas, bylaw officers will continue proactive enforcement. As always, officers will continue to first educate residents on the health and safety measures before seeking compliance. When calls for enforcement come through 311 or other channels, the city bylaw officers will respond first. Depending on the nature of the social gathering, they will respond with the support of Peel Regional Police officers. Victoria Day long weekend is around the corner, and stay-at-home orders remain in effect. We urge everyone in our community not to attend or host group gatherings. Businesses are advised not to rent out or allow the use of their property for private illegal social gatherings. Let's remember that we are in the middle of a pandemic, and large gatherings and planned protests present a great risk. Let's stay safe. Thank you.
Thank you, Councillor Singh. And now we're going to hear from our Medical Officer of Health, Dr. Lawrence Lowe.
Good morning. Thank you, Mr. Mayor. Thank you, Councillor Singh. and I appreciate the opportunity to stand here with my friend and colleague, Dr. Naveed Mohammed, and to offer my sincere thanks and gratitude for the work that William Osler has also done throughout this pandemic, standing next to Peel Public Health in collaboration through 3 waves in one of the hardest hit communities in Canada. Really grateful for our continued collaboration with our Osler colleagues and all of our other partners and community partners. This week, Brampton's test positivity is at 14.5%, with a weekly incidence rate at 327.6 cases per 100,000. These are still extremely high levels of transmission, but we are fortunately starting to see a decreasing trend take hold. I am concerned that levels still remain higher than our Wave 2 peak, and this is reflected accordingly in our hospitals, where admissions continue at steady pace with early signs of stabilization. It really speaks to the importance of continued adherence to the stay-at-home order and to limiting contact out of one's immediate household. As of today, however, we have delivered over 850,000 vaccines in the region of Peel and have hit 60% first dose coverage of our adult 18+ population. Projected appointments indicate that we will hit our goal of 75% first dose coverage sometime next week. We are getting closer, and this is thanks to the provincial hotspot allocation that has allowed us and our hospital partners to build our capacity to over 20,000 doses a day across all channels in our community. With that capacity and continued supply, we opened yesterday to 16+ who live, work, and attend school in Peel, and as mentioned by Mayor Brown and Dr. Mohammed, tomorrow morning Peel Region will open appointments to youth 12 and older, 12 to 15, through our booking systems in accordance with ministry direction on hotspot eligibility and Health Canada guidance. Please visit peelregion.ca/COVID-19 vaccine to book online at any of our community clinics, and keep your eye out for continued mobile and community outreach offerings. On the topic of community outreach offerings, I'm thrilled to share that the past weekend, our Doses After Dark event delivered nearly 5,000 doses in one of the hardest hit communities in Peel, giving us a renewed hope as our community came together to start our race to 75% first dose coverage in earnest. I was filled with gratitude at seeing the diverse Peel community reflected in those that attended the clinic, and I want to thank everyone from our community and our team who did the 32-hour marathon and participated in something special. We learned many lessons around hours that we will reflect in our clinic and future efforts going forward, and we now have significant momentum that we need to continue building on. As I've said, transmission rates remain high, hospitals are still contending with capacity challenges, and variants continue to remain in our midst. We don't want to go backwards. So we need to continue to limit our contacts as much as possible, distancing, masking, and meeting outdoors only with those we do not live with for essential reasons, and not meeting if we're sick. I really urge you all, as we approach this long weekend, please maintain these measures across this long weekend so we can enjoy the other long weekends ahead in summer and be assured of that. And if you haven't done so already, please get your first shot. Now is the time. The vaccines are safe, they are effective, they prevent hospitalizations and mortality that continue to threaten lives in our healthcare system and continue to limit our interactions. And please, if you have received your first shot, remember to stand by for your second. The approved products in Canada are not a one-and-done deal, and we need broad 2-dose coverage to fully return to a life more ordinary. I know we all want to get back to school, gatherings, nights out with confidence, and the vaccine is our best way to do that. So again, I urge everyone, if you are aged 12 or older from tomorrow, now is the time to get your shot, and the faster we get through the vaccination phase and campaign from first on to second doses, the sooner we can start to exit this pandemic with confidence. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe, and on that note, we're happy to take some questions. First on our list is Courtney Heels from CP24.
Good morning. This question is for Mayor Brown and Dr. Lowe. We know the province will soon release the new reopening plan that will be without color-coded framework. What are you hoping to see in the plan, and do you think regional measures should be considered this time around?
Well, I'll let Dr. Lowe speak to this, but let me start off by saying the GTA is completely interconnected. People move work throughout the GTA. I had my doubts about splitting up the GTA in past reopenings and closures. The cell phone data that the GTA mayors have looked at shows that when you open one area, they simply go to that area. And the data is very transparent. And so understanding how interconnected the GTA is, I hope that there is a regional approach to that reopening, and I'm sure Dr. Lowe has more to add.
Yes, thank you, Mayor Brown. Thank you, Courtney, for the question. Certainly hopeful that the reopening plan will move gradually to reopen our community, certainly in keeping in line with international experience. We know that it is a fine balance between increasing rates of first and second dose coverage in communities, as well as decreasing transmission and hospitalization trends, and really making sure that whatever gets opened, there is an appropriate observation period to ensure that the impacts of that reopening are measured, and that subsequently it then proceed to another phase. So really gradual with monitoring periods, and ideally starting with some of the lowest risk activities first would be my preference, but certainly respecting the enormous challenges facing our provincial counterparts as they navigate reopening. Thanks.
Thank you. My next question is for Dr. Mohammed. We are, of course, starting to see COVID numbers come down a little bit and hospital numbers, but we still know, as you alluded to, there are a lot of people in hospital right now and in ICU. So, sir, are you able to speak to who is being admitted at this time? Are you seeing individuals who perhaps haven't had access to the COVID-19 vaccine, or are you seeing connections to workplace outbreaks? What are you seeing in your hospital?
So we still continue to see the pattern that we've seen in the first two waves, which is that more of the people that are being admitted are the older patients. We have had some younger patients throughout all three waves. The workplace spread is one of the places where we are seeing and have seen in the past patients pick up the virus and then bring it home to their older relatives. That is decreasing now because a lot of the work that we have done throughout the province, and especially here in Peel, on pop-up clinics and workplace clinics. So that part is decreasing a little bit. In terms of vaccinations, the people that are getting COVID and then might be hospitalized are people that either have not been vaccinated or may have been vaccinated in the week or two before they showed up at the hospital. So the vaccine hasn't had a chance to build the immune response within their body. But people that have been vaccinated a longer period apart, so if they have been vaccinated a month or two before they got the virus, those people are not being hospitalized and those people are not getting a serious illness. So once again, going back to what Dr. Lowe was saying, the vaccine is preventing hospitalizations and serious illness as long as it has had time to build your immune response. Thanks.
Okay, our next question is Graham Friss from the Brampton Guardian.
Hey guys, how's it going? I'm just wondering, I guess we'll start out, is Paul Morrison there? Maybe we could get some more details about this third assault on the bylaw officer, just sort of where it happened and sort of some circumstances around it.
Good morning, Graham. I can tell you that it happened in a residential area within the city of Brampton. We responded to calls for complaint by the neighborhood. We attended. Our officer was confronted by a couple of people, and then subsequently 15 people that had been socially gathering and drinking, and then another 15 people in the backyard that had been playing volleyball. We requested Peel Regional Police attend. They attended, they helped us, they assisted us in identifying people within the party. We broke up the party and we did subsequently charge some people. During the interaction, our officer was threatened, and at one point he had to go into his car and leave the area because of the escalating anger of the crowd. It's been resolved, we're moving on, and that's the end of that incident.
Great. Okay, great. I guess my second question would be for Mayor Brown and Dr. Mohammed. I guess over the past couple of weeks, the number of COVID patients has kind of been falling, but the transfers over the last 2 weeks were sort of in the 130 area there. How many transfers were this week, and what kind of patients are being transferred? Is it mostly COVID patients or patients coming in for other ailments, or sort of what's the situation on the transfers?
So I'll have Dr. Mohammed speak to the transfer of patients, but let me say that situation really speaks to the fact that the health infrastructure in Brampton has this investment that we've been pleading for has been long overdue. It's why this new provincial commitment on the new hospital at the Peel Memorial site is so critical, because we did not have the health infrastructure that other communities have had. And I think COVID, it really highlighted that. It laid to bear some of the health inequities. And I think Dr. Mohammed's team have done an exceptional job with the resources they have. But it's why those investments in healthcare infrastructure in Brampton were so critical. It shouldn't be the standard operation that you have to transfer patients to other hospitals. And in terms of how many this week and why this has been essential because of being over capacity, Dr. Mohammed can speak to that.
Yes, thank you for the question. So here at Osler, and specifically at Brampton, our transfers have decreased over the last couple of weeks. And that's just because the IMS, the GTA IMS system, is also assisting some other hospitals close to our region with transfers. There's really no one specific type of patient that gets transferred. The IMS team reviews the patients in each hospital each day, and then a decision is made centrally and passed on to us. So, for example, yesterday we transferred 2 ICU patients, but there are some days where we don't transfer ICU patients. We may transfer other COVID-19 patients or other non-COVID patients. And it all depends on what availability the receiving hospitals have as well. So it's a spectrum of patients that are being transferred based on what our need is and what is available at our sites, at other sites. Thank you.
Okay, our next question is Steve Picard from in Brampton.
Thank you. The question is for Dr. Mohammed. And the question is, with your unique perspective, what do you fear most moving forward, especially with the push to reopen the economy and to loosen restrictions?
Well, I think in the immediate past and the immediate future, I did have some concerns on the special days that come along. We've just gone past Mother's Day. We've just gone past the end of Ramadan, and we've got the May 2-4 weekend coming up. And even though we are still in a lockdown phase, the weather is so nice out there, and I know that people do get tempted and are very, very tired of not being able to be more mobile and more active. So that's my fear right now, is that some indiscretions may occur and we may get spikes 2 to 3 weeks after May 2-4. In the a bit more distant future, I have a very, very positive outlook, and I'm very, very confident that our vaccine drive, and we're approaching close to 60% of Peel residents vaccinated, eligible Peel residents vaccinated. And as we go down to the 16-year-olds and then the 12-year-olds, that percentage will only go up. And once we get to more than 70 to 75%, then I'm hoping that the number of cases will truly decrease. We will still have COVID with us. I think people need to understand that COVID is not going to be gone next June even. We will still have some cases that we will have to manage, but the number of cases will become much more manageable, and over time we will develop immunity so that we treat it just as we treat the flu every year. Thank you.
And the next question is for Dr. Lowe. And the question is, other municipalities have been concerned about the supply of vaccine over the next few months as the age limits get lower. Are there any concerns here in Peel about the vaccines and supply?
Thanks, Steve, for the question. Thanks to the province's focus on the hotspot allocation, we do continue to have sufficient supply for the capacity that we have built, but that is not going to last. And so I think certainly as we move towards second doses, as we open 12-year-olds at this point in time, this is our doses are going to go fast. We're doing 20,000 doses a day across our entire system, if not more. Often there's more beyond that. So we are hopeful that, and the ministry is aware of the significant challenges we face in Peel. We are asking for a flexibility in allocation, at least coming up, where we have the ability, hopefully, to request where we do start to see a need, to ensure that the allocations do remain adequate to supply our clinics. But thanks to that supply, as I mentioned, Steve, we are at 60% covered of our adult population today, and we are now tracking towards 75% as of next week and 85% as of the first week of June. Thanks so much.
Okay, our next question is Nitin Chopra.
Thank you very much. My question is to Dr. Mohammed. What is the efficacy of vaccine against variant of concern, including B1617? And also, do you see any concern for black fungus virus here in Canada? Thank you.
Can you just repeat the last part of your question? Do I see any concern?
Here in Canada.
Okay. So the vaccines that we are providing here in Canada are effective so far against all variants. Now, they are effective to different degrees, but we have seen a good response with the variants that we have present here in Canada right now. As far as the 1617 variant, which is the variant that is causing such unfortunate circumstances in India, I know that there has been some concern about vaccine effectiveness, but the vaccines that are being used in India are a little bit different than the vaccines that we're using here. So I'm very confident that and hopeful that we will continue to have significant protection. In terms of whether I fear or I have a concern about that variant, and I certainly do, because we are in a very, very diverse community here in the region of Peel. And I know that not only do we have the airport, the GTA airport right in Peel, but a lot of our community members who originate from that region of Asia have their final destination here in Peel. So we have to continue to be vigilant with the processes that have been put in travel, and we have to continue to be vigilant on vaccinating and following public health guidelines. And as we do that, I'm confident that we will continue to move forward through this difficult time.
My follow-up is for bylaw officer. Paul, there's a very good initiative by City of Brampton when they display a list of licensed contractors. But when we looked into the list, there are many things which are missing, like contractor license number, what services they provide, their phone number, and many companies, they are numbered companies, and you cannot know like what services they offer. And also, do you plan to publish car and truck driving schools, those who are licensed, on your website? Thank you.
Good questions, Nitin. I can tell you that going down this road, we're relatively new at it, publishing the contractors' names for the driveways, etc. We don't have all the detailed information as you have suggested. A number of companies are difficult to locate the actual owners. I know there's legislation coming that may expose the ownership of those companies through some federal initiatives. We're waiting on those. We're going to continue to enhance the website as best we can given the information. We know what we've done to date has been very good, and we want to continue that process. Thank you very much for your call.
Okay, we have time for one more question before we have to go to our council proceedings. Nikki Cedrone from the Bramptonist.
Hi, good morning.
Morning.
There's been some confusion with dental health care professionals getting their second dose. Others have been turned away while others have received their second dose. Are healthcare workers eligible for their second dose?
Okay, we'll have Dr. Lowe speak to that.
Thank you, Nikki, for the question. Peel Public Health is, and our community partners are adhering to ministry guidance on which healthcare workers can be prioritized for second doses. It is important to note that not all healthcare workers are eligible for second doses. There are specific highest risk healthcare workers that have been prioritized to access second doses at a shortened interval at this time. And so certainly eligible groups have received that communication and are being prioritized accordingly. Thanks for the question.
That's all I have. Thank you.
Okay. Well, thank you very much for tuning in to our COVID-19 update. Thank you to Dr. Lawrence Lowe, Dr. Naveed Mohammed for their ongoing dedication to the health of our residents in Peel Region and in Brampton, to Paul Morrison and his team at Brampton Bylaw that continue to go above and beyond. Thank you very much. Stay safe, stay healthy, and please be careful this Victoria Day long weekend.